So some of the people have wrote in to Chrysalis wondering more information on telehealth services. So we have some questions from individuals in the community wanting to know a little bit more about telehealth. So I have a few questions for us to answer. Question number one, what are the advantages to telehealth counseling?
I think during this time, there are so many families that are going through things that we've never gone through before. And the families that we served before the pandemic, we are able to continue serving, which we feel so grateful for. And more families are coming who are presenting with either stressors related to what is happening in our world at this time, and also are realizing like, oh, we can work on some of these concerns even during this time.
Mm-hmm. Yeah, I think it has also allowed, I would say, an increase in connection because we get a glimpse into the client and the family's world, and we're able to see people, animals, stuffed animals, toys, and just what does home look like. And then they also get to see kind of what our home looks like, and I think it really enhances that connection between clients and us.
I think another huge point is convenience. People don't have to leave their home to have a counseling session. They don't have to drive 30 minutes to come and see us. They can go into the next room and have a counseling session with their therapist, not only for themselves, but also their kids as well.
I'm finding that so often with the clients that I am seeing. I see people early in the morning. So starting at 6 a.m., I'm able to start seeing parents so that later in the day, it's not interfering with their work day. And also, their children are almost always sleeping. And if they do wake up during that time, they're able to accommodate that and take care of it and still get their needs met in a way that was more challenging before telehealth. In fact, a lot of families have said, could we still do the parent part by telehealth after COVID is no longer a concern?
Yeah, I think it also allows for parents to be in different locations and to still be able to come to sessions. So we've had parents who are at home, and then one of them is at work, and through telehealth services, they're able to both be at session, with their kiddos. And so it just, again, kind of just lends itself to being really, really inclusive of kind of all situations too, and wherever the family's at in those needs.
Yes.
One of the things that I really like is, a lot of the families that we're working with are working parents. And so it's nice to have, early morning appointments, say even before parents go to work. So it's nice to work on some parent strategies and different tools during that time. And then seeing families as a unit later on and really working on some of those challenges that we might have talked about early in the day, and really seeing those struggles and challenges in that moment, and really helping them with those tools and strategies that we may never see when they're in the office.
Mm-hmm. Yeah, another thing that I'm really enjoying about telehealth is I've split my schedule in a way that I would not normally split it. So I'm seeing people early in the morning, and then so that I can work with my own children and their education. I'm taking a break from doing therapy in the middle of the day, and then I'm coming back and seeing people again after doing some education for my own children. So really reflecting a lot of what families out in the community are also, you know, dealing with in terms of their lives at this time.
Question that people wrote in is, are clinicians becoming trained in providing telehealth services? I know for me personally, before starting telehealth, I did some training for a couple of days to really become familiar with telehealth and how do you run this program? How do we engage families and clients, especially younger kids? How do we get their attention? And, you know, what are the resources that we can use in providing telehealth services?
I've been really impressed that all of the therapists have done both formal and informal training, that many people are looking at like formal workshops, but also communicating with their colleagues and being in Facebook groups or email listservs where they're getting many different interventions that might be effective in the clinic, but are especially effective right now in this telehealth format.
Yeah, I think that telehealth has kind of offered an opportunity to shake things up a little bit and, you know, push clinicians to, yeah, we do have to be prepared for, you know, the change in delivery, and it's kind of offered a fun, you know, opportunity to explore like similar interventions, but how you do it in a virtual setting, or just even new interventions and ways that telehealth has kind of opened our practices up to explore ideas that might be helpful in the future, even when things go back to, you know, a more normal, more sense of normalcy like we had before with, you know, face to face. So I think it's really brought, and I think it's allowed for connection too during this time, which we're all craving connection, and so it's kind of offered, you know, a way for clinicians to connect with each other and talk about, yeah, like the experience for us as well, because it was a new thing for all of us, and having to adapt to that has brought us closer together.
Mm-hmm.
Well, and
yeah, as colleagues and in that patient psychologist or therapist relationship, it has been so interesting to me to hear parents and grandparents, foster parents say, you know, my child was so looking forward to seeing you and having this session. That is something that really matters. I've also been super impressed that, I will just be honest, I did not think telehealth was something that I would ever do. And I have been so impressed with how effective it is. We've had to shift, we've had to be flexible, but I have seen how it works. And like maybe we're incorporating the parent more, or maybe we're doing more directive work, but we're seeing results, and that has been really wonderful.
well, and to kind of piggyback off of both of you, is you talked about having that connection. And I think, you know, to let people know too, is the fact that telehealth has been around for many, many years. And when we look at, you know, the reason why telehealth was invented was, you know, to provide services to people in rural communities that didn't have access to therapy services and in their hometown. And so they reached out to, you know, larger towns that provided these services. So I think it's one of those things too, is, you know, letting people know that this has been around for several years. You know, a lot of therapists have had training, including myself, years ago on telehealth. So a lot of therapists know about it, but now we're just really using it more on an intensive, regular basis.
Mm-hmm.
Another question that people asked was, what therapy approaches do you offer for telehealth? I know one therapy approach that all three of us were recently trained in was First Play. And that is working with infants and children up to the age of 2 and their caregivers, and really working on that storytelling and massage therapy. And that is a great service and that we provide to families. And it's great in person, but it also works very effectively online too.
Yeah, that's a great point, Julie, because we in fact were trained in this all online, and had, in our trainings worked with parents and their babies. I think mine was only 3 weeks old, and so I got to be with a mom in Chicago with her infant. And so, yeah, I think we're still able to do a lot of the approaches that we have been doing, what we typically offer in office, but actually kind of being able to expand our reach a little bit to people that maybe we wouldn't have had the chance to meet or interact with. And so that has been kind of another advantage of this side of telehealth. So being able to offer kind of very, very similar approaches that we have. I mean, you have to do some accommodation, but yeah, it looks very similar to what we have been doing already.
Yes, and I'm finding that doing play therapy is something that has been very effective. I have therapeutic cards and play therapy tools, so I have a lot of puppets that I used when we were in office that now I'm using just differently, but by telehealth. And the therapies that we would typically use, we are seeing that we're able to use with some adaptation. So, for example, I have worked as a play therapist since 1996. I love play therapy with such a passion. Usually I use some directive and non-directive approaches depending on the individual child. Where now using telehealth, I am finding that I'm adapting by being more directive, and I always use some, but I'm using more directive approaches, really geared towards what am I seeing when I'm in session with the child, and what do I know they're capable of doing in that environment with this mode of providing the service. So it's a way of being flexible in how we do the play therapies. And I know with adults, our providers are doing work that is very similar to what they're able to do in clinic, and with effectiveness rates that are similar.
Well, and to, piggyback off of that, I think, finding different tools and strategies that families have in their own home. So there's a carryover of, what we're doing in session and then what they can do in the home. And, one of the great things, Emily, is your cat was in the background. Sometimes we can use that during our sessions. And I think having animals and having tools and strategies that people actually have in their homes, and having that as a carryover and having that level of connection with people is very therapeutic.
Yeah, I think you're completely right, Jolie. And it just, I think our clinicians in general at Chrysalis really pride ourselves on being creative and loving, to have different approaches to therapy and to be as creative as possible. And so that's just kind of, extended into this telehealth world where we get to use our creativity and the idea of self-expression can look like any number of things, and it can look like whatever the client needs. And so I think that's, you know, what's really cool about this as well, is that, you know, through infants through adults, we're able to see the whole lifespan and really tailor interventions to client and family needs. And that's all part of the services we offer too, is that individualized support.
I'm seeing that having my parents more and more involved has been very helpful. So when I do happen to have a child who may not want to engage as much, I have found it very easy to say that is completely okay and normal. Now, what can we do during this time to really work on some of the parenting pieces, or have you be my co-therapist, really implementing things, which of course just leads to things being even more effective.
And then another person wrote in, and I think this is really an important question to address, and that is, does telehealth help reduce anxiety, depression, and other mental health concerns? I know what I've noticed is I'm not finding any difference between in-office counseling and telehealth. We're all addressing those same concerns, and I'm seeing the effectiveness.
Absolutely. Many of the things that we know from the research are helpful for depression and anxiety, or say behavioral concerns. We're able to implement. We're doing it differently, but we definitely are seeing what the research says, which is that telehealth is effective.
Mm-hmm. Yeah, and I think, you know, just kind of going off of that too, is that it's a lot of progress in therapy is made because of the relationship, and also the willingness of the client and family to change and grow. And so if both of those things are there, which, you know, they are still very much there, and actually we've talked about ways in which that relationship and even just strategies has increased throughout telehealth. And so having that foundation, it just creates the environment and the space for growth and for healing, just like it would if we were in person in the office.
So thanks everyone for coming together and answering some of these questions that people wrote into us.